Hello, good evening. Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Welcome to today's clinic, our open clinic with Dr. Chudi on YouTube. Now, today's topic is actually a very rare phenomenon, a phenomenon we call hidden pregnancy or denied pregnancy phenomenon. So I know you'll be wondering if it's possible for someone to be pregnant up to the point of second trimester and in some cases, even up to labor. I'm sure you've probably read some documentaries where they told us that, oh, this lady just had a baby, but she didn't even know she was pregnant until she went into labor. I'm sure you're wondering, is it really possible that a woman will be pregnant and she didn't know she's pregnant until she went into labor, until she went to second trimester, until she went to third trimester? Now, in as much as this condition is very rare, it's actually possible to have hidden pregnancy phenomenon. So that will be the topic we are going to dissect this evening. So I want you to quickly join me once you come in and just announce your name. And as soon as we can, I'm going to start the presentation. It's going to be very interesting to understand some phenomenon in medical practice, which though rare, they can happen. So all those, watching documentaries, looking at stories, imagine a scenario of a probable teenager or just maybe a lady in her 20s carrying her baby, but looking baffled, looking perplexed and rattled because supposedly she didn't know she was pregnant up to the point of delivering the baby, up to the point of going into labor. She didn't have all those classical signs. And you're wondering, is this one of those movies? Is this one of the things they tell us that might likely be possible? So the big question is it really possible to be pregnant and you don't have all those practical, visible symptoms? Or probably there are a couple of things you need to know about it. Now, most women will be very anxious, especially if you belong to the believing for baby category. Practically every month, you check your pregnancy test, you do your urine pregnancy test. So you're now a specialist in checking for pregnancy tests. Now, this is the expected way to look out for a baby. Becoming pregnant should be a planned process. It should be something you should look forward to. So if you're in the categories of women that have been running so many pregnancy tests, you're not alone. You're not going crazy. You're just hanging out there and planning things ahead on time. Now, in as much as the condition I'm going to talk about is rare, it's possible. Now, from current research, we actually discovered two phenomena of the scenario I'm trying to paint. And both of them, for some reasons, they commonly have some psychological problems. So women that might have this particular problem, we actually call it problem because it's abnormal. So from a current research conducted in Germany, they discovered that these two women can have two phenomena. One is hidden pregnancy. In hidden pregnancy, the lady, preferably a younger lady, is intentionally hiding the pregnancy for herself. So she knows she's pregnant, but she's intentionally hiding it. And somehow, our mind is a powerful tool, including our brain. The opposite of what I'm explaining today is what we call pseudosciences. There are some women that are not pregnant, but they want to be pregnant. And they can condition their mind, and they can condition their brain, and they can condition their hormones to have the symptoms of women that are pregnant, meanwhile they are not pregnant. This particular condition and the phenomenon is called pseudosciences, false pregnancy. But we are talking about women that are intentionally hiding their pregnancy. So it's possible. That's category one. The other category is what we call denied or negated pregnancies. Now, in this situation, the woman actually doesn't even notice the symptom of pregnancy. And it's because of probably some psychological problem, some psychiatric problems, some mental health issues, and they are kind of disconnected from their body. Now, what are the signs of women that might have these two phenomena? Generally, they might have the same symptoms of pregnancy, but it might not be pronounced. So, in these women, when we bring them to the clinic, because remember, there are some elements of psychological and mental health problems. So, when we bring them to the clinic, you will discover that they have swollen abdomen. So, they have the baby bump. It might not be too big because women can be wired differently. There are some women that naturally they know they are pregnant, but their bump will not be manifest until the early part of the third trimester. So the common denominator when we examine, we'll see an abdominal swelling, which is the baby bump. Now, these women, when we also ask them clinical questions, we'll discover that they're easily fatigued. Some of them might not have had their menses. And some of them, if they are used to having irregular period, they will not connect the fact that the absence of their menses actually meant pregnancy. Now, some of them might have lower back pain. Some of them might have increase in appetite. And some of them unexpectedly will start adding body weight. These are classical presentation of normal pregnancy, which can happen but less pronounced in women that have hidden pregnancy or denied or negated pregnancy. Now, what are the likely reasons for women to have these problems? I know as a normal woman, you'll be wondering, is it really true? Is it possible? What might be the reason why this particular thing might happen in some women? Number one, the symptoms of pregnancy, like morning sickness, which to some people, they feel that morning sickness is vomiting in the morning. It's not true. So if you're looking out for morning sickness only in the morning, in this particular category of women, instead of vomiting in the morning, they will likely vomit in the evening. So they will not connect the vomiting they have in the evening with the vomiting they should have in the morning based on expectation. Now, the second reason, it's not good one. There are so many abused women out there. There are some women growing up, they were raped, they have incest, they were molested sexually by their, relatives. Majority of people that molest people are actually people that know them. So if the pregnancy outcome in a sexually abused lady, maybe in rape or incest, the woman will disconnect herself. So she will refuse to acknowledge that she's pregnant because she has traumatic experience. So anytime she remembers she was raped, she would deny the fact that she's pregnant. So this is also another reason that might happen. Now, some younger women, especially teenagers, might have had one sexual encounter, but they are training to enter their school team, sports, soccer, basketball, athletics, to the extent that they are not even thinking about pregnancy. Remember that excessive exercise can condition your body to stop performing the normal role. So, women that are into extreme sports, or you are training excessively to enter a particular team, you will not connect pregnancy at that stage. So, if that lady is training hard enough, she will not have all those visible, obvious signs of pregnancy. Now, you need to be careful on this fourth reason. It's important to know how to check for your pregnancy correctly. Sometimes you might have false positive pregnancy test or false negative pregnancy test. So if you took your pregnancy test and it was incorrect, they told you it's negative when you are actually positive, and you normally experience irregular period, you will not connect the dots. So it's important to check your pregnancy properly. Now, majority of women might have irregular periods. So not seeing your period might be your normal. But this time around, you cannot connect the dot that the extended absence of your period is actually pregnancy. So some women might not have seen their period for 2 months and they might think it's normal because some days, some months, their period will not come. But this time around, they were pregnant. And the pregnancy did not present with all those untoward symptoms, but they were genuinely pregnant. Now, some women that recently added a lot of body weight, that means your body mass index is higher than 25. Some women will be tending towards 30 or even in the 40s. You might not correlate the fact that previously the body weight you added and the recent weight you're adding might be a sign of pregnancy. So women that are overweight or women that have obesity problem might not be unaware that the fact that they are adding weight now might actually be pregnancy. So that can also contribute. But here is the deal. While some hidden pregnancies make sense, some are simply a case of mental health problem. Because majority of these women will have what we call psychosis. They are not normal people. They need help. So while some might make sense, the mother needs help. So if you come across a teenager or your friend and you're suspecting, lately she's adding a lot of body weight and she's disconnected, she's acting odd, encourage her to seek medical help. All we need to do is to run a quick, simple medical test, blood test, check an ultrasound, and normally developing pregnancy will show us evidence of the baby in the womb. So whatever I'm telling you today, it's not uncommon. The frequency of denied pregnancy in Germany is not uncommon. They discovered that 1 in 475 pregnancies, women will not be aware until 20 weeks. Think about that. 20 weeks. If you add extra few weeks to 20 weeks, a baby can be born and a baby can be perfect. So if you get up to 20 weeks and you add extra 7 weeks, a baby born at 27 weeks can still make it if they go to NICU and they have adequate facilities to take care of the baby. So this condition is actually not uncommon. So matter of fact, in some setting, it's more common than rhesus factor problem. Now, some little tiny population of women will actually proceed to go into labor without knowing that they are pregnant. So the frequency of denied pregnancy and the frequency of denied labor, it's out there. It might be rare. Now, the frequency of denied pregnancy and denied labor, when you look at denied labor, is actually fewer. So you can have 1 in 2,455 births. They didn't know they are pregnant until they went into labor. Think about that for a moment. Now, this is what I'm going to tell you before I end my presentation. Please, if you are believing God to be a mother, it's a proactive process. That means you are intentionally praying to God. You are intentionally making love. You are not using contraceptives. You are intentionally checking for pregnancy tests. This is because whatever I've explained today is not your regular. So it's not something that will happen to every woman. It's something that might happen to some teenagers, some young girls that had traumatic experience. So they have disconnected from their body. So hidden or denied pregnancy can happen in any socioeconomic group, any race, any religion, anybody. Anybody can have psychological problem. Anybody can have mental health problem. But it's important you are very much aware about your pregnancy, because if you are pregnant and you miss your ANC for the first trimester, you've done a lot of injustice to your baby. The first 3 months in your pregnancy will determine how your baby is going to turn out. So being unaware of your pregnancy, even for only the first 20 weeks, can have potential risk factor to your unborn baby. So please, if you are sexually active and you experience persistent, unexplained weight, fatigue, missed period, or any of the symptoms I mentioned, please go to your doctor. Chances are that you're pregnant and you might not really know because you're not looking forward to that. One sexual encounter can lead to pregnancy, including non-penetrative lovemaking. Okay, so guys, the clinic is going to open now. Please feel free to ask me questions. And immediately after this clinic, I'm going to give my own other presentation in Facebook. So please, if you can, join me in Facebook immediately. So I can see COO is in the clinic. COO, please, the floor is all yours. Let's have some clinical discussion. I know you always ask some brain-teasing questions. So here we go. Sometimes women actively believe God for babies, often mistaking fibroid for pregnancy. Oh, yeah. That's a subset of pseudosciences. You see, In our political, cultural environment, they have conditioned some women to be fearful of certain things, to invoke certain things, to expect certain things, to behave in a certain way. Now, majority of women of African origin will develop fibroid. For some reasons, we don't know the exact reason why this happened. But statistically, if you're a Black woman, the possibility you have fibroid before you enter menopause, it's very high, up to 6 out of every 10. Now, in some women, because of that persistent need, because of that persistent quest to become a mother, they intentionally believe that they are actually pregnant when what they have in their body is fibroid. This is the reason why some women will go to some fraudulent churches and prayer houses, and they will tell them, you have been pregnant for 10 months. You have been pregnant for 2 years. Matter of fact, your pregnancy is 3 years. But someone in the village is raising remote control to stop you from delivering your baby by 9 months. And some of them will even go for cryptic pregnancy, the so-called cryptic pregnancy. You will go to somewhere, they will take someone's baby, they will give you that baby, and you will think is your baby. Meanwhile, it's not your baby. And you will go for Thanksgiving, and you will go for testimony, and you will tell them, for the past 2 years, I've been carrying this pregnancy. For the past 3 years, I've been carrying this pregnancy. It is not true. There is no baby that can go beyond the expected date of delivery. Once a baby gets to 42 weeks, that pregnancy must be immediately delivered. It's called post-date. There is absolutely no truth when anybody tells you, oh, for 2 years I was carrying a baby and God suddenly delivered me. It's not true. So some women might actually have fibroid, especially intramural fibroid and submucosal fibroid in their womb. Some fibroids can be so big that you might look like you're in your third trimester. So if you have this, please go to a gynecologist. You are doing yourself an injustice if you are not pregnant and if you don't have a mental health problem, but you're deceiving yourself that you are pregnant, whereas what you're carrying is fibroids. You don't have that liberty of wasting time, because as a woman, every single year you spend is significant. So 100% of all those women that show up in your churches, that show up with those, pepperish testimonies of 2 years of carrying a pregnancy, 3 years of carrying a pregnancy, and suddenly the Holy Spirit appeared and the people in the village released the baby they were holding. It is not true. You cannot carry your baby beyond 10 months. 9 months is the maximum. 42 weeks, equivalent to 9 months. We have to bring your baby out by any means legally possible. So that's the presentation that they are trying to explain. And guess what? Every pregnant woman should do the right things. You don't go living in a prayer house. Prayer house is for spiritual things. When you become pregnant, retain the services of a gynecologist who is also an obstetrician, who will be looking after you. When you become pregnant, initially, we might be giving you 4 weeks appointment. Then as your pregnancy is getting closer, we want to be seeing you frequently so we can keep an eye on your baby. Every pregnant woman must have the evidence of pregnancy in the urine. You must have the evidence of pregnancy in the blood. Then we must visibly see the baby developing in your womb. If we don't see that, my sister, you are not pregnant. So you need to seek antenatal care visit, so that if we discover anything that will stop you from becoming a mother, then we can do our best to help you. It's very important. Okay? Do we have any other question? This is very, very important. Unfortunately, only few people attend important topics. You see all those cryptic pregnancy craziness in Nigeria. This is one of those subsets. You cannot be pregnant and it's not visible. Now, like I told you guys, depending on your scenario, depending on your age, depending on your experience, A teenager that had love making for the first time, even if the boyfriend did not penetrate, can become pregnant. Let me paint a scenario for you. That your beautiful daughter who is innocent. Now, I'm going to correct this. The fact your daughters or your cousins or your friends' daughters are making love, they are not bad people. They are not crazy. They are just inquisitive. And there is also something called love and youthful exuberance. So the fact your daughter might be making love now doesn't make her a bad daughter. I'm telling you the truth. There are some virgins that can do worse things that can kill people. Now, you need to tell them about sexual education, because whenever you're in the presence of the opposite sex, there is something called hormones. When you are attracted to someone, your body will react. So the tendency they will make love even without penetration. Once there is fluid coming out from the penis, that fluid can get any woman pregnant without the penis entering inside the vagina. It's called non-penetrative pregnancy. So it's possible. So picture your daughter that went to the university to study, and she got there and she saw her Prince Charming. This guy is really, what she's always wanted to be. And there is nothing wrong in liking people. Now, in one of their hangouts, they decided to experiment what they've been watching in movies or what they've been reading in books, and they were together. And when you're together with people you care about, you definitely have feelings. So long as you're a human being, you are supposed to be attracted to people. If you are not attracted to people, you have a medical problem. You go to a doctor. So imagine that your daughter, one night, they were kissing and doing all those stuff, and they came closer, and the young man's penis got erect, and there was fluid, which we call pre-ejaculation, came out from the penis, and they had contact. And that particular fluid that came out from the penis happened to be, sprinkled around the groin area of the girl. Because if they're kissing, the possibility they are closer is high. So any fluid that comes from the vagina, from the penis, that, plays around the periphery of the vagina, can get her pregnant. Because at that stage, if she's in her 20s, if she's below 20s, her fertility is very, very, very high. So it's possible that that first night she wanted to experiment was the night she ovulated, and that sperm was available. And the young man, of course, the younger you are, the more the quality the sperm will be. So the young man sperm got her pregnant, and she didn't even know. She wanted to break into the basketball team. She wanted to break into the soccer team. And she continued to exercise. She continued to work out. She continued to do the things that ordinary girls would do. And somehow, when you are going through exam stress, when you are going through school run stress, sometimes your period will not come and you might think it's okay. So she didn't know she was pregnant until even second trimester. She didn't know she was just, trying to look sexy, covering herself and all that. Of course, how can she begin to have that conversation with her parents? Then lo and behold, they rushed her to the hospital. And she was 28 weeks pregnant without knowing. It's possible. It has happened before. So it's not something that happened to people that are actually looking forward to becoming pregnant. It's something that happened to some select people, but it's possible. Okay? All right. Do we have any other question, please? So if you're among the people that, they've told stories about cryptic pregnancy, be careful. Very, very, very careful. You will not forgive yourself if you've damaged your family by going to another person's family and taking their babies illegally. Avoid that. Okay? All right. If we don't have any other question, then please remember the event we have on the 26th. Mega Super Masterclass on multiple pregnancy. There are so many members in this community. As I'm talking to you right now, it's your portion to be a twin mother. It's your portion to be a triplet mother. It's your portion to be a quadruplet mother. Now, I'm telling you that it's possible. What you might be lacking might be the knowledge. There are natural tendencies that if it's peculiar to you, you can improve your chance of becoming pregnant with multiple pregnancy. There are assisted reproductive techniques we can also apply, and you can increase your odds of becoming pregnant with multiple pregnancy. Now, if you love twins, triplets, quadruplets, if it's your desire to end your infertility in 2023, please join us on the 26th of this month 9 p.m. Nigerian time. Let's fellowship. It's my firm belief that so many of our members are gonna begin their journey of being a twin mother, triplet mothers, quadruplet mothers in the month of February. If everything goes according to God's promises, of which God has never failed in his promises, by October 2023, you will have your twins, you will have your triplets, you will have your quadruplets. Now, the slots are very few. You will not understand this until you blink on the 25th of February and you want to wangle yourself in and you no longer have a place. Go and register today. Admin will share the links in our Facebook. Please make it a point of duty to register. Make sure you invite your friends. Now, as you're registering, there are some people we need to help. There are some people we are better than. There are some people that don't have the resources. There are some people that don't have the money to attend. We have to take care of them. So if God puts it in your mind, in your spirit to sponsor women, sponsor them. When we all become mothers and fathers, then we will generally be happy. Okay? Remember to register for this event. Admin will share the links in our Facebook. When you register, follow the simple instructions, and by the special grace of God, we will fellowship with you guys on the 26th. It's going to be amazing. We have 2 subject matter specialists, 2 fertility specialists, one in Lagos, one in Abuja. We have tried them. We have been friends. We are collaborating. We have been dealing with infertility. We have been having results. Come, let's fellowship. Let's see what we can do to help you so you can become a mother and a father exactly how God purposed it. Okay, so thank you so much. And please remember to join me in Facebook immediately after this, and we continue the conversation on our page. Admin, thank you so much for coming. I appreciate you. I think I saw God is able 2021. Whoever you are, thank you for coming. I appreciate you guys. I will see you guys in Facebook shortly. Thank you and bye-bye.